So these are just additional ligaments and tendons in the finger area, but honestly, it's like a lot, so I'm not going to go into it. And you can always look through these yourselves. This just shows you the mid-sagittal section of the digit. So N is obviously the navicular bone, and it shows you everything else. So when I refer to P1, P2, P3 in the upcoming presentations, this is what I mean. I think the key things, obviously, this is the superficial digital flexor tendon. This is a really good picture, actually, if you ever get confused. The straight sesamoidean ligament, which is mentioned, I think, once, lines P1 and the fetlock joint. Then you have the deep digital flexor tendon, which is also not only deeper, but significantly larger than the superficial one. And yeah, you know, obviously this area forms the spring mechanism we were talking about. So superficial, digital, navicular bone, and I think there was something else. So anyway, there's no clear picture to show here, so I'll just show you the slide. So it says the undulate border. So this is, it says a hairless stripe between the skin and the hoof. Girdles the horn capsule, so basically covers the horn capsule like a ring. And there are 3 layers: the horned epithelial layer, the sublameral dermis in the form of papillae, and subcutaneous tissue. Maybe it shows it here. Nope. Anyway, so you have the coronar undulate. So these are coronary papillae that form the thickest and strongest layer of the horn capsule, which is known as the supporting horn. And it has a structure like tubes, and it grows from the crown to the step edge. Sorry, I'm trying to like make this as clear as possible. I think this is a better picture maybe. So the Hoof, or Parries undulate, I'll show you the word as well. It's an extension of the corona. I'll show you the word. And in the horse, this covers the wall of the hoof bone, obviously, so it covers the wall of P3 at the front and at the sides, and in the back parts you have hoof cartilage. And in the heel corners, it turns at like an acute angle forwards to the step, and it gives the wall part of, and it makes up the wall part of the heel. You also have the coronary papillae. These are like leafy-like structures, and their number is about 500 to 600 in horses. Let me find the papillae for you. Yeah, these are a bit more zoomed in, so I think these are the coronary papillae. And they have secondary and tertiary branches that increase the surface area of the wall 10 to 80 times. So yeah, this is kind of what I've been on about, really, the papillae here, and honestly, it just like makes me cringe. It's really gross. Anyway, so you have the stratum medium, or corneum. It's made of the horn lamellae that fill the space between the leaf-like papillae of the lamella corium. So this layer is considered a connection between the corium and the horn capsule, and this makes the horse, it says exundulation, I assume walking very difficult, to mobility. So I'm going to try and find the stratum medium. Yeah, so this is the stratum medium. This is made of the horn lamellae that fill the space between the leaf-like papillae on the inside of the lamella corium. Yeah, and that's why this is considered the connection between the corium and the horn capsule. So sorry for repeating myself, I just didn't really know what I was looking at. These are blood vessels, so obviously a bit convoluted, so I'm not going to go into that. So yeah, now we have the sole. What the hell is the sole? It's the bottom part that touches the ground, so it can be palmar or plantar surface. The sole, or soleus undulate, you can see the word here. It closes the hoof on its underside and has a semicircle shape. And you have ring pads on the horses, which are made of the frog, or the forza pulvini, so you can see the word here. The frog is basically, I always say triangle, but it's also like an arrow shape if you prefer. And you have the hoof bulb and bars called the pulvini. I'm trying to find the hoof bulb, but yeah, so these are the bars here, and the hoof bulbs of the heel, there you go. Yeah, so it says the ring pads on the horses are made up of the frog and hoof bulb and bars. Okay. So you have the horned foot, or solea cornea. In horses, it has 2 surfaces, the upper one, which is the convex and facing the corium, and you have the lower one, which is concave. So this is convex, and this is concave, and it's in contact with the ground. Now, in some diseases and deformities, the indentations on these areas can be reduced, which forms in the formation of a flat or full hoof. So what happens is the connection between the horn wall and the horn foot is made in the white area, which is the linea alba. You also have the horn frog, so the corneus. This is the triangular horn plate. Yeah, I'm trying to find the horn frog here, but I assume it's just referring to the frog here. So yeah, it's the triangular horn plate. It plays an important role in the spring mechanism in horses. So it's not just, you know, those superficial and deep digital flexor tendons I mentioned in the navicular bone. It's more than that. So it differs. So you have the body, which is basis cunei. You have two hips. I assume this is the area. Crus cunei. Laterale et mediale. So obviously one of them is going to be on the outside and inside of the horse. You have the apex, and you have the middle sulcus of the frog, called sulcus cunealis centralis. So obviously sulcus cunealis, which means frog, and centralis, and you have two lateral sulci, paracunealis, lateralis, and medialis, and in the caudal part of the hips pass into the bulb of the heels. Yeah, don't get bogged down into this. I did my best. Yeah, so we'll just talk about this. So yeah, in terms of the hoof horn, it's important because what it does is it has lower weight, but it also has a lot of strength for everything that has to go there, including the weight of the horse itself. The horn on the hoof wall and the bulb heels are also very hard for this reason because they're so strong, and they have very little flexibility and water permeability. So sometimes we even talk about cows, they get foot rot because their feet are always submerged in water, they're not very permeable. So the foot horn becomes softer and more elastic than the foot horn is softer and more elastic than the wall horn. And you have the glazing horn, the frog, and the heels. They're formed by soft and supple horn that absorbs moisture quickly and dries quickly. And the hoof horn has about 40% of the water. In terms of hoof growth, it's an intense process that occurs in every part of the hoof, not just the ones, not just specific parts, and it's because you have continuous multiplying matrix cells, and you have the glazed and tubular wall horns that grow from the corium to the step edge, and you have the leaf horn forward from the laminar corium to the middle layer, and the step horn. It says the horn of the foot and frog is fully recovered in 2 months. The soft and supple horns grow faster than the hard and brittle ones, which makes sense. And you have untamed horses grow faster than horseshoes. So obviously horses without horseshoes, their hooves grow faster. So let me try and find one of these. Okay, so it's trying to show you the proper placement of the pectoral and pelvic limbs in horses. Oh, pelvic limbs, sorry. And when viewed from the front of the thorax, so if we go here, we imagine like a line, and it descends from the middle of the shoulder joint, which halves the carpal joint and ends in the middle of the hoof. And when we examine sort of the sides, the thought line kind of goes through the same anatomical structures. Oh, sorry, this is the front. But ends on the caudal surface of the hoof, so the bulb heels. And when we examine the pelvic limb behind, we imagine a line from tuba ischi, which descends, splitting the tarsal joint, and it ends to the middle of the hoof. In the lateral view, the thought line starts from the same place, so tuba ischi, and touches the caudal part of the tarsal and fetlock joint. This is important because you have incorrect positioning and staging of the horse limbs, and then we'll probably take a break from here. So there are 4 limbs that show you the shoulder to the ground. So this shows you like intermediate, camped out, camped under, the knees, so they should be tied in. This shows it's straightened, chopped at all knees. Sorry, it should be this cannon angle. So you have bow-legged here, you have straight here, and knock kneed. So these are abnormal. Just remember everything in the middle is normal. So if I've misled you, I'm sorry. For the forelimb knees, so you have bucked knees, you have calf knees, intermediate knees, intermediate, base wide. So this is about upstandingness, and base narrow. So imagine your thought line. Knees relative to the cannon or the forearm. So this is straight, offset cannon, inset cannon. When we're looking at the hoof pastern axis, so this is straight, this is sloping, clearly it's like really low, and you have broken and upright. So you'll see this, especially in a lot of diseases, like I think laminitis or the deformities we mentioned. This is the pastern angle, so you have toe out, toe in, and straight. And you have the foot slope, so straight, sloping, and intermediate. It's kind of the same as the hoof pastern axis, if I'm honest. I just wanted to show that to you because it may come up. So we'll stop here and we'll carry on from the hind limb.